Today we'll be discussing tennis elbow. Tennis elbow is a condition that can occur in people who have never touched a tennis racket before. I tell my patients that 90+% of patients who develop tennis elbow have not really played tennis before. It got the name tennis elbow from the backhand of playing tennis, and that's usually why you get pain on the outer part of your elbow. And sometimes patients will point to the back part of the elbow because they're not able to quite localize where that pain is. And it can be caused by trauma or repetitive use. So on exam, I look for tenderness in that spot, the lateral epicondyle, which is that bone that sticks out at the side of your elbow. And when I ask patients to resist me, they'll often will point to pain in that area. And then x-rays are usually negative. And then if you were to obtain an MRI, which is done after weeks of treatment without improvement, you can sometimes see tears of that tendon. The treatment is, long wrist brace that will immobilize the wrist, because that wrist extensor is what causes the problem. And anti-inflammatories, therapy, and sometimes steroid injections or PRP injections that have actually shown to be extremely helpful recently. Surgery is the last option if conservative management fails, but I would say 90 to 95% of all tennis elbows can be treated without surgery. So if you look for these signs, you may be able to prevent the need to seek care. One thing that I always tell my patients is that avoid picking up objects with the palm down, always palm up. And stretching exercises to stretch out that tendon, and then the use of over-the-counter anti-inflammatory medications such as ibuprofen or Motrin or Aleve. So tennis elbow is pain on the outer part of the elbow. So the bony prominence in the side of the elbow is the lateral epicondyle. Sometimes patients will say, oh, the pain is in the back of the elbow, but when you push all around, they often will have pain specifically in that bone there, the lateral epicondyle. And then what I do is I ask them to keep their elbow straight and extend their wrist with the finger straight. And then when I pull and they resist me, they'll say, ouch, and I ask them, where's the pain? And if they say the pain is right there, then that's my tennis elbow. But if they say the pain is there and there, then sometimes tennis elbow occurs with something called radial tunnel syndrome, which is compression of the radial nerve there. And that's often because the muscles there are tense and therefore compressing that nerve as well. So those two things can coexist as well. If you are feeling any of these symptoms currently and you need to come in to see me, please go online and book your appointment at Peachtree Orthopedics. Thank you.